The World Report on Disability, published in 2011, showed that about 25 million Nigerians had at least one disability, while 3.6 million of these had very significant difficulties in functioning. These were the case of some children who were brought in by their parents to partake in the medical health fair organized by the HASKE Children Foundation recently. A pediatric and volunteer at the HASKE Foundation, Aisha Muhammad Jibril, highlights the most common disease conditions seen amongst disabled persons.
It's usually a lot of them come with cerebral palsy. And this is a condition that affects the development of a child. You find that the child cannot achieve what the child is supposed to do. The child that is supposed to be walking is still sitting. The child becomes dependent. So that's the most commonest cause. And the cause of this cerebral palsy, most of the times they are preventable. And that's why it's important for us to spread the message across. Once your child have jaundice, go to the hospital immediately. If your child start convulsing, go to the hospital immediately. Anything that is, if you think, convulsion can be from meningitis, and it's also important to vaccinate your child against most of the childhood diseases.
Fatima Muhammad, a mother of two girls who were diagnosed with jaundice after birth, shares her ordeal in catering for two children with severe health issues.
Thank God for everything. We thank them. I'm happy for coming here. Yes, they did something. They advise us. They advise me especially with twin that I should not just leave them that is a spiritual work. No, there's something from the brain. Right from the birth, because it's not well cared. We didn't take them to the hospital for the first time. They gave birth in the hospital at Barodiko, but not knowing that they have this jaundice. After some days, we take them back, and I just take them home. We did in traditional one, not.
Gaskiya sai dai godiya Allah, mun gode da taimako da suka mana. Gaskiya Allah kuma ya saka da alheri, mun gode wa gwamnatin jihar Kaduna saboda tana taimakon mu irin mu iyaye da bamu da ƙarfi, suna taimakon mu yanzu. In ba don an ba mu wannan abu mun zo ba mu san me yake faruwa ba, and then mun zo kuma yanzu na san dota na tana da damuwa tunda an ba ta magani da za ta sha, kuma wannan abun ba wai mun ba da kuɗi ba ne, an ba mu kyauta ne, kuma sun taimaki lafiyar 'ya'yanmu ne, shi yasa muna musu godiya.
Meanwhile, partner HASKE Foundation IAED Sahad Haruna speaks on the inclusion of persons with special needs in education, especially from low-income backgrounds, adding that proper sensitization is done by the foundation against neglect by parents towards children with disability.
Culture and religion sometimes steps into some of these things, where maybe if a child has a disability, they might link it to something like spiritual possession or stuff like that. So how we try to do is that even though this is a program, it is not a school, it is a program, but we've designed it in such a way that it functions as a school. So we have PTAs, we meet with the parents, and we try to make them understand that just because their children has a disability, or maybe their children are having some learning difficulties, it does not mean that they have any form of problem. It just means that they might need more attention, and you don't neglect them. It's difficult sometimes, to be honest, to kind of convince the parents. For example, one of our students that has a disability, it has been a challenge for us to try to convince the parents to help us, to allow us to, help them, overcome that type of issue. So the short answer of it, to be honest, is a continuous process, but you have to be very patient.
More sensitization and awareness are being done by foundations like HASKE to ensure persons with disability are given the care they deserve by both their loved ones and the society at large.